Hi, I am Dr. Gaurav and I am hair transplant surgeon. In today's video, I am going to specifically discuss about Sapphire Blade Micro FUE or Sapphire Blade FUE technique. So the basic technique of hair transplant are FUT and FUE. There are two main techniques in which FUT is the one where we take the strip from the back of the head, a superficial segment of the skin, and FUE is the one where we take one hair out and transplant. Now FUE has been the most commonly used procedure done by most of the surgeons around, but they need something to market it, some different name to market it. So everybody has started giving it a new name. The basic concept remains the same. In FUE, we take one by one hair out from the back and transplant immediately in the front. Now there are various steps in the hair transplant which I'll try and show you in the form of photographs and videos during this video. So in the first step, what we plan is we design the hairline. That's the most important part of the procedure, and it is done mainly by the surgeon. Nobody else should be designing it. The surgeon, his hand has the expertise to design the hairline. In that hairline, there are different patterns. If it's a young boy, there's a different pattern. If it's a bigger hair transplant, the area has to be covered is bigger, there's a different pattern. Density in the front is good, in the middle it is little low, and in the back it is more lower. So we will decide according to the age, the area of baldness, how the design of a hairline should be, whether the temples has to be included or not, is the part of the hair designing. Now this designing is done by either needles or a stainless steel blade or a sapphire blade, which has been lately marketed now. So it doesn't really matter whatever method you use, it's already in the hand of the surgeon. It mainly depends on the surgeon who is designing your hairline, but still sapphire blade has a little more few advantages. It's on the perspective of the surgeon. Result wise, we've seen no difference. We've been doing it with needles, we've been doing with stainless steel blade, we'll be doing with sapphire blade also. So the result wise, it is mainly no difference. Cost wise, a sapphire blade costs a little more expensive than a needle or a stainless steel blade. The cost wise, it has a little higher cost. Otherwise, everything remains the same. The people say that you get good density with sapphire blade. Density is with what thickness of the blade you are using in. If the thickness is more, obviously the density will be less. If the thickness is less, the density would be good. Now it depends upon how thicker the grafts are. There are different parameters for it. Although the good points of sapphire blade are it causes less tissue damage, healing is faster, it doesn't get blunt easily. So it is not a metal or it is carved from a stone, so it doesn't get blunt easily. So for the surgeon's point of view, there are advantages. So surgeons are more comfortable using sapphire blade. Again, the results of both sapphire blade, stainless steel blade or needle is almost same. We've been using sapphire blade for last 1.5 years. Before that also we were giving consistent results. Now also we are giving consistent results. So using sapphire blade has caused a little ease during the procedure, and that's it. Nothing major. I'll be putting up certain results after this. You can have a look on that. Thank you.